Welcome back to a special edition of Africa 54 on Ebola crisis in West Africa. Lenore is now going to tell us what's happening on the treatment front in the battle against Ebola.
That's right, Vincent. The predictions are grim. The number of people in West Africa infected with Ebola will increase drastically before the outbreak ends. But doctors are learning more about treating patients with this disease, lessons that could improve survival rates. Again, here is VOA's Carol Pearson.
In August, 2 patients with the deadly Ebola virus were flown from Liberia to Emory University Hospital. In September, a 3rd patient was flown to the Nebraska Medical Center in Omaha. These 2 hospitals have special isolation units and teams that are trained to handle infectious disease emergencies. In this training video from the Nebraska Medical Center, the patient is transported in his own isolation bubble. At Emory University Hospital, Dr. Jay Varkey says supportive care is the key to beating Ebola.
What this experience has sort of taught me is that those sort of things, supportive care, one-on-one nursing, availability of labs, IV fluids, replenishing electrolytes, are really some of the keys to treating Ebola virus.
Electrolytes are chemicals that regulate our nerve and muscle function, fluid levels, and blood pressure. They're essential in rebuilding damaged tissue. Even at treatment centers in West Africa, Dr. Varkey says patients would do better with more aggressive treatment that replaces electrolytes like potassium, magnesium, and calcium, and fluids lost through diarrhea and vomiting. 2 patients at Emory, Dr. Kent Brantley and Nancy Wrightball, received an experimental treatment called ZMapp. So few Ebola patients have received it, it's hard to say if it works.
All the available data that we've looked at, it is impossible for us to determine whether this drug played a role in improving their symptoms, not doing anything, or even slowing their recovery.
The doctors at Emory have been sharing their experiences about the role of supportive care with doctors in West Africa and elsewhere.
Our hope is that by being able to maximize and optimize that supportive care, that we'll really be able to decrease the amount of deaths and devastation that this virus has caused.
Currently, the virus kills most people it infects. But with the construction of more treatment centers in West Africa, the delivery of more supplies, and the arrival of more healthcare workers, many more Ebola patients are expected to survive. Carol Pearson, VOA News.